Okay, thanks very much for the opportunity. I think, these are the two most important issues of the day in terms of global health, global development, our collective future as a planet. In the first panel, we talked about the issue of vaccine nationalism, who would get what, and on the one hand, the panelists emphasized the incredible progress that has been made through CEPI and COVAX to bring a vaccine quickly to regulators and to countries, and to reserve doses for the poorest countries in the world. But that said, everyone, of course, is concerned about speed. We know there are manufacturing supply constraints over the next couple of months, and that therefore we really do need to think not only about fully financing COVAX to be able to get vaccine through that mechanism, but also to share the surplus doses in high-income countries that have purchased vaccine to vaccinate their own populations many times over. I think there is some discussion of what other kinds of interventions could we be making to assure quick access to vaccines. Obviously, the regulatory process is extremely important. We want to see, Dr. Tedros talked earlier about the importance of having WHO pre-qualification as part of the critical path. That's what will enable us to get as many candidates as possible to as many countries as possible. We've talked about new investments in manufacturing. Is it possible to manufacture more outside of the places that currently manufacture doses? Would that speed delivery? So either through voluntary or compulsory licensing has been discussed in other places. And then, the very difficult process of setting priorities for who gets what, both within countries and between countries. The importance of having perhaps a vaccine summit to make these agreements more explicit. Obviously, what happens with this discussion is not an academic discussion. This is a real world. We all leave this meeting. We all would like to have a vaccine. So having a clear view from around the world on how to proceed, how we can live that vision of trying to get all health workers and the most vulnerable vaccinated first, and then the rest of us. The second panel reflected on the interruptions that we've seen in essential health services, but it also looked at what we meant when we said essential health services. So not just health interventions, but the other wraparound interventions that make it possible to really survive this period of extreme hardship, especially in low-income countries and populations that are not able, where exports have collapsed, or tourism or other sectors of the economy that just are not working as they would normally. So a couple of ideas were floated. One was around accountability, so making sure that we keep track of what is happening in real time, that we hold national decision makers and international decision makers accountable for what happens in this space. There's been some good guidance issued by the World Health Organization. The question is now to act on it. We also talked a little bit about the financing situation, both internally and externally. That also has a really important role to play in sustaining essential services. So a call to at least sustain levels of spend on non-COVID interventions. Dr. Ole Norheim also talked about the importance of countries themselves having defined an essential package of interventions to be sustained and expanded at all costs. That needs to be part of the conversation with World Bank and with others when budget support operations come in as a result of all this. And I think I'll stop there, but just to thank the organizers. As we know, Norway and Norad play an extremely important role in this space through your long investments in Gavi, in CEPI, in global health security. You've always been leaders in global financing facility. So I hope to see more of Norway in all of these discussions. Thanks very much.